So guys, let us do legal blindness together. I hope you're learning. I hope you are. So you can just join our tutorial session anytime you want. +254 945 147. So legal blindness for us. So we are going to look at the legal blindness, and as I'm saying, I would like you to understand what it means for somebody to be legal blind. So we are saying, before we do that, the visual acuity is able to assess the vision. So usually, you will get a chart in the ophthalmologist office, and they will tell you to read the first big letters as you go down to the smaller ones. So if you're able to read the small letters, most of the time you'll get a vision of maybe 6/6. So the numerator and the denominator are the same. So if you read, maybe you did not read the last one, you'll get 5/6. So now the numerator starts to become smaller. So when you talk about a vision of 20/200, as you can see here, that in a client who is legally blind, the best visual acuity with the corrective lenses in the better eye is 20/200. So it means that this is very poor vision. So this client may not even see. So when you're not able to read anything on the chart, they'll just go ahead, they stand a distance from you, and then maybe they can lift their fingers and they ask you to say how many fingers you can see. Some people will not see the fingers until you get closer to them. And that is where they can tell you, I can see something, I cannot tell whether it is a finger. And still, if they can't, you can just maybe wave at them very close and ask them, what am I doing? Some of them might recognize your waving, and some of them might not even recognize your waving. So we are saying that in legal blindness, it is a very poor vision. And this is a vision in the better eye. The best they can see is 20/200. When you see the numerator being this high, it means that this client can barely see. Or a visual field. What is a visual field? A visual field is what you can see when you look ahead. When you're standing or where you are, you can be able to see maybe even something that is happening on your side there. So you can see maybe a whole 180 degrees of vision. So a whole protractor. You see the protractor that you used in high school. You can see a whole of it. Now I want you to imagine a visual field no greater than 20 degrees in its widest diameter in the better eye. So I want you to imagine that protractor, and you can only see 20 degrees of that. So you can barely see anything. So that is what we mean by legal blindness. This is a client who cannot barely see. And we are saying that the visual acuity is going to be 20/200 or less, or even the visual field is not going to be greater than 20 degrees in the widest diameter of the better eye. So what are the interventions if you have a client who is legally blind? So this one is now what we call legal blindness. So when you're speaking to the client who has limited sight or is blind, the nurse should use a normal tone of voice. So you're not supposed to shout at this client, but you're supposed to use a normal tone of voice. You're supposed to alert the client when you're approaching. Do not surprise them. Just maybe say something when you're approaching so that they can know you're there in the line of vision. Then orient the client to the environment, orient them. And when you talk about orientation, you have to ensure that they can be able to do the most basic things for themselves. Like maybe they can be able to go to the washroom. You can tell them from the bed, you're going to get a table, and then on your right, you're going to have the washroom there. So that is very important so that the client can be able to be as independent as possible. So you also use the focal point, like I've used a focal point as the bed, and then you provide further orientation to the environment from that focal point. Ensure that the client has a clear path. So do not place things on the room that the client, maybe shoes are there just down there and everything, and the client can just fall because they cannot see them. So remember, this is a client who cannot see. So you have to really organize the room. They have to touch objects in that room. They understand this is where the table is. This is where I can see it. All that. And then you allow the client to touch objects in the room. Use the clock placement of food on the meal tray to orient the client. So when you're organizing the food in their meal tray, tell them that maybe the beans are at 10 o'clock, the rice is at 12, and then we also have vegetables in that plate at 9 o'clock, so that they can be able to eat everything from the tray. Promote independence as much as possible. We've talked about it. And also you can provide radios and televisions and clocks that give time orally rather than providing time they have to look at it. They cannot see. And also you can be able to use the braille watch if it is available. They are going to be able to appreciate that. When also abulating, allow the client to grasp the nurse's arm at the elbow. So they have to grasp your arm at the elbow, and the nurse keeps her or his arm close to the body so that the client can be able to detect if you're changing your direction. Then you instruct the client to remain one step behind the nurse when abulating, and this is just to avoid the client stepping together with you, lest they may fall. Then instruct the client in the use of a cane for the blind, and this one is differentiated from the other canes by its straight shape and the white color with a red tip. And then instruct the client that the cane is held in the dominant hand several inches or centimeters off the floor. Then you also instruct the client that the cane sweeps the ground where the client's foot will be placed next to determine the presence of obstacles, to determine if there is any hole. So they have to ensure that they use it adequately, and sometimes you have to educate them on how to use the cane. So most of the time you just have to show them how to use it, because it is something that probably they have not used, and it is there for safety. So the main objective of having this cane for the blind is for safety, to ensure that the client does not step on grounds that are uneven, to ensure they do not fall, to ensure that there are no obstacles and all that. So you have to train them on how to use it so that they can be able to adequately use it for their safety. A home health nurse makes an initial visit to a client diagnosed with legal blindness. Which of the following recommendations should the nurse make first? Call a plumber to set a hot water tank's thermostat to 100 degrees. Use battery operated, so this is degrees Fahrenheit, kindly note that. Use battery operated appliances rather than electrical appliances. Remove most of the furniture from home. Purchase clothing that is easy for the client to don.